I think we've lost connection over there, but I think some of the points that she highlighted nicely flow into our discussion, especially on health and infrastructure and regional diplomacy. So I think we're going to go back to Ellen, and we're just about to start a discussion on the health impacts worldwide and in Pakistan altogether. So I think if the minister is still online, maybe we can still go to Ellen and continue discussion on health and come back to the minister later. So please go ahead.
Thank you so much, Dawar, for allowing.
Dr. Hakim finished. Am I audible?
Yes, Mr. Saba, you're audible. We're just going to take some remarks on health from our WHO representative and I'm going to come back to you.
Okay, perfect.
Thank you very much, Dawar. First of all, let me thank Dawn Media for organizing this timely conference. And the question that has been posed to me this afternoon, and the one that I'm going to talk about, is the impact of air pollution to health, and that can also extend to the impact of climate change to health globally as well as particularly in Pakistan. Air pollution has a serious impact on health, but it is in our hands to prevent and mitigate this impact. According to the recent Global Burden of Disease report, air pollution in Pakistan is responsible for approximately 128,000 premature deaths annually. If the first slide could be put up, and these deaths are preventable. And Pakistan, as a country, faces severe air pollution, particularly in urban areas, namely Lahore, Karachi, and as well as Islamabad, where smoke levels frequently exceed safe limits. In last November, the IQ Air rated the city of Lahore as the most polluted city in the world, with an air quality index AQI score of 1,165, and the Dawn newspaper reported this, a level that rose to an unprecedented score of about 1,900. The slides are not coming up, but they're just the pictures of what I'm talking about. Increased emissions from vehicles, industries, brick kilns, combined with the seasonal wildfires and crop burning, contribute to dangerous increases in the levels of fine particulate matter, and this exacerbates respiratory diseases such as asthma, chronic obstructive pulmonary diseases, and lung infections, particularly among vulnerable populations, including children and the elderly. Children mostly because their immunity is not yet built strong, and also the elderly because their immunity is wearing out with age. This also has great impact when it comes to pregnancy outcomes and complications to pregnant women. A study by Pakistan Ministry of Climate Change also found that air pollution contributes to a significant rise in hospital admissions due to respiratory and cardiovascular illnesses. Air pollution should not be discussed in isolation of climate change, so I'll still bring in the issue of the health impact of climate change. For instance, climate change brought negative impacts through extreme weather events in various years in Pakistan, increased disease transmission, food and water insecurity, as well as displacement. WHO estimates that between 2030 and 2050, climate change will cause an additional 250,000 deaths per year worldwide due to malnutrition, malaria, diarrhea, and heat stress alone. The World Economic Forum report published in 2024 also warns that by 2050, climate change may cause an additional 14.5 million deaths and $12.5 trillion in economic losses worldwide. In countries like Pakistan, rising global temperatures also increases the risk of heat exhaustion, heat strokes, and cardiovascular diseases, particularly among vulnerable populations such as the children, the elderly, and outdoor workers. According to the World Risk Report 2024, Pakistan is among the top 10 most vulnerable countries to climate change and other overlapping crises, including extreme weather events, floods, droughts, and air pollution. In June 2015, a severe heat wave resulted in approximately 2,000 deaths, primarily in Karachi, and more recently, in June 2024, over 568 facilities reported in southern Pakistan, reported fatalities in southern Pakistan due to extreme weathers. Factors such as climate change, rapid urbanization, and deforestation contribute to the increasing frequency and severity of heat waves, leading to higher mortality and morbidity rates. In Pakistan, warmer temperatures as well as changing rainfall patterns expand the habitats of disease-carrying vectors, such as mosquitoes, increasing the prevalence of diseases like malaria and dengue. You would agree with me that during the mid-2022, after the flood happened in Sindh and Balochistan, there was a rapid increase in malaria cases. And between January and August 2022, over 3.4 million suspected malaria cases were reported in these provinces. And in the subsequent year, in 2023, over 2 million cases were reported for malaria, against an average of less than 500,000, which was the trend since 1973. Water sources also, because they are contaminated, lead to outbreaks of waterborne diseases. We saw a surge of cholera during the flood response. We have also seen a surge of dengue, even last year in 2024, especially in Punjab, including Rawalpindi, which is just next door to Islamabad. The impact of air pollution and climate change, as well as extreme weather conditions, is well documented, and the actions that can be taken have been discussed throughout the sessions from morning up to now, and they include reducing emissions, enhancing sanitation, promoting sustainable energy sources, forestation, designing infrastructure according to climate resilient, and also ensuring that we improve water sanitation, waste disposal systems for health facilities as well as industries. And also, let me underline the need for awareness, individual awareness and action for each one of us to protect their health, sometimes with simple measures such as being informed and following recommendations during heat waves about being well hydrated, as well as staying indoors when the air is polluted, things like those that each one of us can take part in looking after their own health. Let me finish by an example that WHO has done, a simple example of providing water filtration pumps that are run using the solar system in districts like Landikoto, Timagra, as well as other areas in Karachi, contributing to the reduction of emissions, but at the same time providing water, clean water source to patients in hospitals, benefiting over 2.9 million patients in 1 year. Let me stop here, but the journey ahead is long, but we have started with the steps that we are in. The clock is ticking, saving millions of lives is in our hands. and WHO stand side by side with Pakistan to face and overcome these challenges and deliver health for all, and will continue to do so. Thank you.
Thank you, Ellen. I think given the scale of the health impact of climate change and air pollution, it's obviously not something that a government alone can tackle. We obviously need advanced knowledge, which the WHO is providing. But other subject that was touched upon by the senior minister as well is regional diplomacy. And I think I wanted to ask Indrika regarding this, that transboundary air pollution, we're seeing two types of it. We're seeing, of course, across the international borders. We're also seeing it among the countries which have different provinces. But particularly, while the provinces among them can coordinate, because we have, for example, in Pakistan, we have the Ministry for Interprovincial Coordination, which enables this dialogue. Right now, between India and Pakistan, or beyond the wider South Asia, if you consider the entire Indo-Gangetic Plain, which is essentially the air pollution, which has the crisis, what can be done at the transboundary level?
Thank you very much. I mean, as the minister has alluded, South Asia has 9 of the world's 10 most, the cities which has the worst air pollution. So I think the data set is clear. And in addition, in the previous session, you heard speakers talking about the black carbon settling on the glaciers from air pollution that enhances glacial melt, has other impacts as well. So it clearly, as you said, is transboundary. And I think the airshed approach, where we look at the entire sub-region, recognizing the transboundary nature and the special interdependence of the whole air quality and that space is important. Concretely, maybe perhaps a few suggestions on how at a regional level we can improve the air management. I think one is to really establish a regional air quality framework that countries come together, look at this, given, as you rightly said, its transboundary nature, and the Indo-Gangetic Plain, for example, India, Pakistan, Bangladesh, Nepal, and form a regional body dedicated to air quality, similar to what ASEAN has tried to do with its regional thing, transboundary haze management. A second recommendation could be to look at cross-border. If somebody could mute your microphone, please. We're getting some feedback. Cross-border monitoring and data sharing. And I think this is vital, given what you had said about the connectivity across the region. Activities that cause air pollution, from where it originates, how emissions travel. These data sets, I think, require cross-border monitoring and data sharing. As previous speakers have said, I think the need for some science-based and data analytics is really important in this exercise, and also trying to perhaps harmonize air quality standards and pollutant measurements, because that also is not really, at least at a regional level, perhaps that's a starting point for this. Sharing real-time satellite and ground-based monitoring systems and that data. And I think finally, not just at national, but at municipal and city levels, how can this data be brought together? And we heard from the minister some very good examples on how this is being done in the Punjab. Secondly, I think coordinating policy actions and emission control measures. Maybe we are shooting very high to and ambitious to look at legally binding commitments, but at least some commitments on emissions reduction, especially for the common causes, like was highlighted, like crop burning, coal-fired power plants, transport emissions, etc. What can we agree to as a common set of standards that could help us control emissions? And then at the same time, I think, simultaneously incentivizing alternatives. This is extremely important because one doesn't really work without the other. Looking at joint policy on crop burning and incentivizing alternatives like biofuel production, I think could be very helpful as well. And then, as the minister also talked about, these are very good examples of how do we phase out high emissions, whether it's in the transport sector or in industries, how that can be done, and really having some time-bound targets for perhaps even uniform emission standards for vehicles could be something we could look at. I think two more points here. One is the role of international institutions. I think the WHO, World Bank, UNEP, and others have a wealth of technical knowledge and upstream capacity support that could be provided, and financial and technical assistance as well, going hand in hand with multinational banks and IFIs. There's a good example from the EU where they successfully managed some cross-border air pollution policies through the Gothenburg Protocol. So maybe some of these examples also localizing it to our context. The Green Climate Fund and institutions like the ADB can also look at vertical and other finances that are renewable for renewables. Engineering, civil society, science, and academia, I think, plays an important role. And I think we have a wealth of expertise in the region, as we saw in the course of today. How can that be more joined up in our collective effort? And last but not least, as you were saying, the diplomatic and political commitment. I think this is quintessential for coming together, because no matter how we have local and regional expertise, platform standards, if that is not brought together with political commitment at a high level, perhaps using platforms like the SAC and bringing up this agenda, up the agenda of these meetings, and BIMSTEC and other platforms, I think also would be helpful.
I think the minister is also was speaking about this, and I think she's online right now as well. I just want to go back to that question that we were speaking about, how Pakistan, especially Punjab, has reached out to the Punjab government in India as well. So I think this is an interesting new dynamic that we hadn't tried before. And I would like the minister to tell us a little bit more about this and how we want to engage the broader South Asia region to really tackle on the air pollution crisis.